Hello, good evening. This is Isha Thakur and I welcome you to Librate's YouTube channel for another live session. Today's session is brought to you as a patient awareness initiative on challenges faced by dialysis and transplant patients during COVID-19 pandemic in association with Sanofi India. In this session, we have the privilege to host Dr. Deepak Kumar, a renowned nephrologist with many credentials in his field of expertise. Doctor Deepak is well known for his leading contributions in more than 200 renal transplantation cases. He is presently working as a consultant nephrologist at Columbia Asia Referral Hospital, Bangalore. His specialty interests includes primarily the renal transplant, both liver and cadaver. He is a member of various societies including member of Indian Society of Nephrology, member of Indian Society of Organ Transplantation and many others. In addition, he has also received Times of India Young Achievers Award in 2019. Welcome Dr. Deepak and thank you for your time for this session.
Thank you.
To our viewers, as we know that these are already proving to be difficult times for all of us as we are hearing about rise of COVID-19 cases at an increasing rate from all over the world through television, through social media, through newspapers, family and friends and other sources. The most common emotion faced by all of us is fear during such tough times. And for combating this fear, we need knowledge from medical experts like Dr. Deepak, who have come forward to help us with his expert advice. During the next few minutes, Dr. Deepak will be talking about how deadly virus can affect our kidneys and what measures we can take to protect ourselves. My request to our viewers who have tuned in, please feel free to ask your questions in the comment section and we will take them later. Over to you, Doctor.
Thank you. Yeah. Thanks for that introduction. And it's an opportunity for me to present few slides regarding challenges faced by dialysis and transplant patients during COVID-19 pandemic. I work at Columbia Asia Hospital, Yeshwanthpur in Bangalore. And since I'm a nephrologist, I deal with the patients who have kidney issues. And the more severe kidney issue, the patient who have more severe kidney issues end up undergoing dialysis. And those who have a kidney donor, either live or a cadaveric donation happens, and they end up undergoing kidney transplant. So we have two set of patients. One is the dialysis patients and the other one is a kidney transplant recipients. Apart from this, we also have various patients who have kidney issues, but they might have mild to moderate kidney issues who require only medications. So this comprises the subgroup of patients in nephrology practice, what we encounter day to day. Now, as we know, the challenges are faced by all the patients, all across, the general population or the kidney patients. Yeah. So now, briefly about, we all know that coronavirus has created havoc all over the world, and it's a pandemic which has caused significant morbidity and mortality all over the world. It's COVID-19 is a new SARS virus which emerged in December 2019. It's called COVID-19. It was first identified in Wuhan when patients had clusters of pneumonia. Now, coronavirus is a large family of virus, as we all know. It can cause as simple as common cold, and it can be as severe as pneumonia and multi-organ dysfunction disease affecting other organs like lungs, liver, kidney, heart, and so on. But apart from this, the most of the coronavirus infection can be asymptomatic, in the sense there might not be any symptoms at all in certain subgroup of patients. So we have asymptomatic patients, we have mildly symptomatic patients who have common cold or flu-like symptoms. We have severely symptomatic patients who end up with pneumonias and other multi-organ dysfunction. So this is a third generation coronavirus, what we are seeing now, which is called as a new strain, and it is COVID-19. It is called as a zoonotic disease because it is transmitted from animals to humans. The bats were known to be natural reservoirs of this virus, and humans are thought to be an intermediate host. Humans are thought to be infected by an intermediate host, probably penguin. It's a very small virus, but look at the havoc it has created. It's a small virus, diameter of 60 to 140 nanometer, invisible, and it has got distinct spikes all over it. That's why it is called as, it resembles like a solar corona, and that's why it is called coronavirus, this COVID-19 virus. Now, a few things about how it can get transmitted, or modes of transmission. It can get transmitted by direct contact or indirect contact, or a droplet mediated infection. The first one, the most common infection, is a droplet spread mode, wherein people sitting in close contact for more than 15-20 minutes in an enclosed space without masks, they are at more risk of developing this droplet infection. And direct contact by touching the hands, and indirect contact by touching the surfaces which were touched previously by the infected people. So these are the most common modes of transmission. Most of these are available all over the net, and most of the people all over the world already know whatever I have introduced about the coronavirus as of now. Now the most important thing is who are at risk of developing this coronavirus infection. Now there are people who are at risk of developing this infection. People aged more than 55 years are at more risk to develop infection. Other comorbidities the people have, like respiratory airway disease, respiratory system, lungs are involved, and they have some underlying disease, diabetes mellitus, hypertension, heart disease, they are at more risk. Now, pertaining to our topic, that is immunocompromised patients, where immunity of the patients are less, particularly the transplant and dialysis patients are at risk. Apart from that, pregnancy and healthcare workers are also at risk. These are the dialysis patients who are at risk. First, we'll discuss, or first I'll give some message about the dialysis patients, and then we will move on to the transplant patients. Now, dialysis patients, why are these dialysis patients at risk? That's a common question what we all get, isn't it? Why they are doing dialysis, but why they are at more risk of developing COVID-19 infection? Because they have associated comorbidities like diabetes, hypertension, lung issue like COPD, and age, elderly age group people. That's why they are at more risk, because of multiple associated comorbidities. And they also do have uremia. Uremia is they have a lot of nitrogenous waste products in their body, which is not removed on a regular basis by the kidney. Though they are undergoing dialysis, still the residual urea and other nitrogenous substance remain in the body, and that can predispose them to develop infection. And other thing is, they are the group of people who frequently interact. Okay, they have to go to the hospital, they have to come back to the home, and they have to meet the doctors there. So they are at risk because they are meeting more people, and sometimes they have to travel to the hospital by public transport. So that's why they poses them of having more risk. Now, this is a very unique subgroup of patient, that is the dialysis patients, ESRD, end-stage renal disease, on maintenance hemodialysis patient. I would say is a different entity or a unique entity. You cannot compare them with the general population or those who have other associated comorbidities, because see, they have to come, patients have to come for dialysis almost 3 times a week, and they have to go back to the community. So that's why they are unique. So every time you can't test them. Every time when they come to the hospital, you cannot keep testing them. That costs lot to the manpower as well as the financial liabilities. Now, they also have overlapping clinical features. Now, dialysis patients might have cough, he might have breathing issue, his blood pressure might be high, and he might have body pains, which might be features of COVID infection also. So that's why, but you can't keep testing everyone. So whoever dialysis patient has got cough or breathlessness, every time if you keep testing them for COVID-19 infection, it doesn't make any sense, because most of it may be features of problem related to kidney disease itself. Now, limited option of postponing or skipping dialysis. Okay, so if person thinks that I am at risk of, who is undergoing dialysis, can think that since I'm at risk of developing COVID infection, I will not go to the hospital. I will not get dialysis done. But is it possible? Definitely not possible, because he cannot skip a dialysis or he cannot postpone dialysis, and we can't keep waiting for the test result. You give a test and we will wait until we take for dialysis. That situation generally doesn't suit, because they might become really sick if they don't do dialysis. Burden and mortality faced by the patients if the dialysis unit is shut down. Sometimes, the healthcare workers might get infected, and patients have to undergo dialysis at a different center. So dialysis center should never be shut down for the patient, because it's a life-saving measure. I would like to quote this sentence wherein we can tell that the risk of patient dialysis due to COVID-19 infection can vary between 1 to 10%. This was an initial report. However, if they don't undergo dialysis, the risk of mortality or death is 100%. So that's why it stresses on the point that dialysis patients should be more worried about missing their dialysis session rather than the COVID-19. But of course, they need to take precautions for COVID-19, which is important. So that's why, as a nephrologist, we need to achieve some goals for these dialysis patients. We have to provide adequate life-sustaining dialysis therapy for all the patients. That is important. We cannot make them not do dialysis, citing the reason of COVID-19. That's a very important point to be understood. And protect healthcare workers from getting infected. We are all healthcare workers, dialysis therapists, nurses, doctors. They should all be protected by appropriately wearing PPE and taking all precautions. And identify the patients with COVID-19 signs early. The dialysis patients who come for dialysis, they might have COVID-19. We have to identify those symptoms early. It might be difficult because, as I told, symptoms might be overlapping. So that's why we should isolate them, separate them. If you have a doubt, do dialysis separately so that they don't spread infection to the other dialysis patients, and then test them. And that's how we can prevent the transmission of COVID-19 within the dialysis unit, because dialysis unit is a closed space where multiple patients come and go, where healthcare workers come and go. So that's why we can prevent the transmission of COVID-19. It's always difficult to strike the balance, so there will be some trade-offs. Now, what are the precautions which has to be taken by the dialysis patient? So all dialysis patients should be extra precautious as compared to the normal people, because they are immunocompromised, as I told. First thing is they should always wear a surgical mask or an N95 mask if they can buy and wear an N95 mask from home to home. So once they leave house, they have to wear a mask and travel public transport or a private transport, get dialysis done. During the entire period of dialysis, they have to wear the mask, never remove it, and then they can come back home and remove the mask. This is very important because they'll stay there for a longer time. Removing mask might be might put them at higher risk. Every patient must perform hand hygiene before entering the unit. So before entering the unit, they should wash their hands with the sterilium or do an appropriate hand wash. And they must usually avoid public transport, because public transport, what happens, so many people would have traveled in that particular public transport, and social distancing becomes an issue in public transport. And contact tracing, though there are some modifications in public transport now, still social distancing might be a limiting factor. And contact tracing, whom they came into contact might not be, we might not be able to trace those contacts over a longer period, because they come 3 times a week for dialysis. Other thing is they should also maintain, practice social distancing at home to an extent possible, because there might be young children, there might be adults who go to work and come back to the home. So, but they can transmit infection to these dialysis patients. So that's why they have to maintain social distancing. They have to maintain social distancing in the waiting area. When they come for dialysis, they wait for sometimes half an hour or 1 hour. They have to maintain the social distancing. And they have to also maintain cough etiquette. Whenever they were coughing or sneezing, they should use the, of course, mask will be there, a tissue or a handkerchief or at least elbow. We should, always educate them regarding this. And the most important thing is, patient should not miss the dialysis session. As I told, the percentage of death if they miss the dialysis session is almost 100%. So that's why they should never miss dialysis session. The other important things is we previously dialysis patients used to eat. They used to eat in the dialysis unit. But now eating means you have to remove the mask for about half an hour or so. So that's why we encourage dialysis patients not to eat during dialysis session. Either they can eat before, finish the dialysis, and then go back home and eat. So these are some of the precautionary measures which we always tell the dialysis patient. Now, this is one of the slides which I like to present. This is from Journal of American Society of Nephrology. In India, so far, we don't have a strong data of dialysis patients and their outcome. See, what happens when a dialysis patient or a set of dialysis patients get infected with COVID-19. As we can see in this particular slide, there were 59 patients, dialysis patients who were infected with COVID-19. Median age of these patients was 63 years, and 69% of them were discharged, but 31% of them died. Okay, so this is a very significant number of mortality, which has been published in American Journal of Society of Nephrology. So the conclusion of this is COVID-19 associated with higher mortality risk with end-stage renal disease on dialysis. So this is a conclusion. So they are at much higher risk. Of course, that it might also be the fact that they are all elderly patients and they have associated comorbidities. So that can also contribute to the death apart from dialysis itself. So regarding dialysis patients, I would conclude by telling dialysis patients are unique cohort of patients. They are a different set of patients. In them, risk of acquiring infection and transmitting infection in COVID-19 unit is pretty high. Also, healthcare workers associated with dialysis are also at increased risk of developing COVID-19 infection, so they should also take proper precautions. So strict protocols and precautions are required in the individual units based on the hurdle. Not every dialysis unit can have all the facilities. So based on the individual dialysis unit, sometimes little modifications has to be done. But the most important things remain are social distancing, hand hygiene, wearing mask, not to eat during dialysis unit, and most importantly, not to miss the dialysis session. So that's an important thing, what I would like to message, what I would like to pass on. Okay. So next we will move on to our next other cohort of patients, that is patients who have undergone transplant. Okay. And they are at home, who have undergone transplant. Now they are not doing dialysis and they are at home and they are taking the medications for prescribed for the transplant. Now, if we compare these patients, who is at more risk of developing COVID-19 infection, whether it is dialysis patient or whether it is transplant patient? This is a common question which always arises. Now, always it is dialysis patients who are at more risk than developing COVID-19 as compared to transplant. Because as I told, dialysis patients come and go 3 times a week for dialysis from home to hospital. Transplant patients tend to remain at home, come only outside for the blood checkup, or they might go for work. Nowadays, it's all more of work from home, so they are protected in that way also. So definitely, dialysis patients are at higher risk than developing transplant. How much higher risk? Is there any data? Yes, we have a data from UK, various centers at UK, which show, as we can see here, these two in this particular slide, the blue marks the transplant patients and the green marks the dialysis patients. We can see that definitely the green tower is higher than the blue, which indicates that dialysis patients are at increased risk of developing COVID-19 than transplant patient, as high as 13 times. Okay, as high as 13 times and as low as 1 or 2 times. So definitely, but definitely they are at higher risk of developing COVID-19 infection. And similarly, risk of death is also more in dialysis patients, but of course, infection is more, so death also becomes more there. Now, transplant recipients. So this is about the transplant patients now. So these recipients have also increased risk of COVID-19. As I told, they are also immunocompromised or immunosuppressed patients. Why they are at more risk? Because their leukocyte count, what we call as blood leukocyte counts, are little lesser as compared to general population. Because it is lesser, because they are treated with some medications which reduces the level of leukocytes or the lymphocytes, and the risk of COVID-19 is higher in immediate post-transplant period. So immediately within the first 3 months or first 6 months, the immunosuppression or the medication levels will be higher. So that makes them more prone to develop infection, or they are at more risk of developing infection. More than 6 months or 1 year, they are not that prone to develop infection. Non-specific and variable symptomatology. This is one of the important things which we need to understand regarding the post-transplant patients. So they might not have fever, cough, or breathlessness on a regular basis. They might present with something else. They might present with some other symptoms like body aches, or mild degree of weakness, or sometimes GI manifestation. Recently, I had one transplant patient who came with hiccups and vomiting, and also some mild abdominal discomfort, and he was tested and he was found to be positive for COVID-19. So what I mean to say is symptoms can be very non-specific, and they may be very variable, but since they are immunosuppressed patients, we should check them for COVID-19, and we might find them positive as well. So that's a take-home point there. Now, no specific treatment guidelines regarding the transplant patients, in the sense whatever drugs we are using for general population remains almost same for the transplant patient. There is no additional or a specific drug which can be given for the transplant patients. Now, the other important thing is all these transplant patients have to be admitted in the hospital because they are at higher risk, because they are little delicate in their health, because they are already immunosuppressed and taking some medications. So admission, lack of admission and lack of beds becomes a major hurdle, and sometimes there might be economic issues as well. Now government of India has provided a lot of beds and they can go to the government hospital, but sometimes they can be overfilling. So that's why early admission should be prompted for these patients. Higher morbidity and mortality and post-op. Again, like dialysis patients, these patients also have higher morbidity and mortality. The risk of becoming sick is higher in transplant patients as compared to general population. Now, this is one study. I will not go into the details of this study. This is again from US, New York. This study was done in June 2020, which again tells that the symptoms like fever, cough, and dyspnea are seen in only 50% of the patient as compared to 80-90% of the general population. And symptoms like diarrhea are much more commonly seen, like 20%, 22% had diarrhea. And hospitalization, most of these transplant patients require hospital, almost 78%. It is quite high, isn't it? And then 96% of them had an infection suggestive of pneumonia. And we will concentrate on this last column here, deaths. 10 out of 36 patients were studied in this particular study. So mortality was 28%. So dialysis also in the US study, we saw it was about 31%, and here it is 20. So it's almost comparable, the risk of death in both subgroup of patients. Again, it doesn't, it is not necessary to get scared or anything like that, but we need to understand that these patients are at higher risk, and that's why they should come to the hospital early rather than delaying and waiting at home. Once they come early, treatment is possible, and most of the patients we have seen have recovered, and they have really done well. Those who have presented late in a situation where they required ICU care or ventilator support, those are the patients who eventually succumb with this disease. Now, our experience, I would like to suggest, this is from Bengaluru Columbia Hospital, Yeshwanthpur, where I practice. So it is, I would say it is a limited experience. It's not a big number of patients, but so far we had 10 patients who developed COVID-19 infection post-transplant period. The mean duration was 6 months, and average age group of patients was 40 years. Among 10, 6 of them had mild infection. See, 6 of them had mild infection and were managed just by supportive treatment. They presented early. 3 of them had severe infection in the CT scan, and they required treatment with remdesivir and favipiravir and other drugs, but they made it. They have recovered and they have gone home. Only one patient who presented late with severe respiratory issue was on ventilator for a few days, and she didn't survive. So so again, the point to be stressed is early identification of any change in the symptoms and then coming to the hospital makes a difference in the outcome. And we also suggest at our center, we do teleconsultation for these transplant patients for regular checkup, and they are informed not to neglect any symptom, and they have to come early and get their checkup done. To conclude regarding transplant patients, now we have also started doing transplant all these days. This was about transplant recipients who are already undergone transplant, but there are patients who are on dialysis, they want to undergo transplant, but we have already started the transplant program at our hospital. So that's why I would conclude by saying COVID has gained all the attention it desired. Now we have known the disease for the last 6 months, we have understood, we know what precautions to be taken, we know how it behaves, and we know there is treatment for it. So now that's why we have given a lot of attention to the disease, but non-COVID work should not be affected. Like, patients undergoing dialysis, or if there is a heart issue, or if they're undergoing transplant, I think precautions have to be taken, and the regular healthcare work should be continued. And we have to create awareness among the healthcare workers and also the patients that, it's okay. And if you take precautions, if you present to hospital early, still you can recover, and then you can do well on a longer run. Of course, for that, you need to take precautions and protocols which are necessary to execute the procedures, which can be life-saving or life-changing. Thank you.
Thank you so much, Dr. Deepak. That was indeed helpful. So now we'll take few questions from our viewers. So, Dr. Deepak, what is the risk of COVID-19 in patients receiving chronic dialysis?
Okay. COVID-19 infection risk, as I was telling in my talk also, the risk of COVID-19 infection is much, much higher in dialysis patients as compared to the transplant patients. The COVID-19 infection is more in the transplant patients, dialysis patients, because they move in and out of the community, and they mingle with the patients in the dialysis unit. And also they meet the healthcare workers, and they go to the hospital sometimes with the transport, public or private transport. So they are at risk. So the risk is, as I was telling, it is much higher than the general population, and it is also much higher than the transplanted patients.
So, moving on to another question, what should kidney transplant patients do if they develop fever, flu-like symptoms, or respiratory symptoms?
Yeah, kidney transplant patients should be extra cautious as compared to the general population or the general patients. So if they develop even the mildest of symptoms like flu symptoms, they should not neglect it. And these are the subgroup of patients, transplant patients, who are not eligible probably for home isolation or home treatment. They should come to the hospital, get their COVID testing done, and then probably based on their situation, doctor will decide whether they will need admission or not. But as I told, most of the scenario, admission will be required for these set of patients, and we have to alter or modify the drugs what they are taking.
So, doctor, one important question we have from our viewer, that what kidney transplant recipients should do to decrease the risk of COVID-19?
Yeah, so since kidney transplant patients are at increased risk of developing COVID-19, they have to protect themselves from developing this particular infection. Hand hygiene is most important. Social distancing is most important. They should wash their hands at least 10 times a day, I would suggest, for about 20 seconds, following all the 6 steps of hand wash. And then social distancing all the time, even at home. See, this is really important. Sometimes people relax or neglect at home, thinking that one of their relatives or one of the family member might not have COVID infection. But since now people are moving in and out in the community, so risk of spread is more even at home. And that's why since they are immunosuppressed, they have to wear mask even at home when there are people around them. And the third thing is minimize the movements into the community or going out. And whenever they are going out, they should strictly again follow hand hygiene and wear mask all the time if they go out. So these are the precautions.
So, doctor, what are the risks involved in patients, acute kidney injuries for transplant patients? What are the risks involved in that?
See, COVID-19 infection can cause acute kidney injury. In the sense, it can affect the kidney and cause temporary rise in the creatinine, what we call as acute kidney injury. Transplanted patients are probably at a higher risk of developing this acute kidney injury because they have one kidney, and that kidney may be present in them for a variable amount of time, and that would have taken insults previously. And mild COVID-19 would not affect any organs, but sometimes severe COVID-19 infection can cause acute kidney injury. and particularly transplant patients are at higher risk of developing acute kidney injury than compared to general population. So again, they should take some precautions like drinking plenty of water, hydrating themselves well. So that would help them to protect against the kidney injury.
Another question we have from our viewer, doctor, that what are the general hygienic measures should be considered adopting in dialysis centers?
Yeah, so dialysis center, I would say, are the breeding sites of COVID-19 infection, unless properly managed. In most of the places, dialysis, most of the cities and even in taluk places, I would say, now there have been very strict protocols and precautions followed to prevent uh, the spread of COVID-19 infection. But despite that, patients should also have their own interest in protecting themselves. So they should again follow hand hygiene, social distancing, do not touch the surfaces unnecessarily. When they go into the dialysis unit, they should not touch the cot or the chair or the ramp present there unnecessarily. And even if they touch, they should always wash the hands. And they should not spend more time after dialysis. Once they finish the dialysis, they should come out of the unit and then they should just go home. They should not keep interacting with the people around. They should not keep meeting the other patients who are in the hospital. They might be infected with COVID-19. So these are some precautions which they will have to follow.
So, doctor, as we know that patients are on home dialysis too. So, what are the measures these home dialysis patients can take to protect themselves from COVID-19?
Home dialysis patients are at lesser risk, that is CAPD patients are at lesser risk as compared to hemodialysis patients because they stay at home and they do dialysis at home. Uh, Despite that, again, as I told, if there are multiple people at home and if there is no separate room, again, they are at more risk of developing COVID-19 infection. So they should, as far as possible, they should try to have a separate room or a separate corner in the house where they can do their home dialysis and wear a mask and follow hand hygiene and also wear hand glove when they are doing the home dialysis. And also the dialysis fluid, which is there. Sometimes if the person is infected with COVID-19, the fluid can be infective. So that has to be disposed properly by taking precautions. So all these things are precautions for patients who do home dialysis.
Another question we have from our viewer, doctor, that there are certain foods which are, suggested for kidney disease, kidney transplant patients. So, what are these kidney-friendly foods our viewers would like to know that they can take?
Yeah. See, diet has gained all the importance. Diet and physical well-being, mental, emotional well-being has gained all the importance during this COVID-19 pandemic. And people have suddenly started realizing, what is more important. So, diet rich in fruits. See, dialysis patients have limitation in taking diet, but transplant patients do not have any limitation in taking the diet. They can eat the protein, a good quantity of protein, which is there in vegetarians. It is there in paneer and soya or mushrooms, and for non-vegetarians in white meat like chicken, fish, and eggs. They can consume a lot because protein is good and it boosts their immunity. Also taking the citrus fruits, orange, mosambi, and lot of lemon also boosts the immunity because it has got vitamin C. And yeah, these are the diet which they should take it on daily basis. And the other important thing is water. We need to concentrate. It is common. It is even for general people. Of course, dialysis patients cannot drink more water, but transplant recipients should drink a lot of water, and even general patients should, general population should keep drinking a lot of water to hydrate yourself.
Okay. So, doctor, moving on to another question. Out of both the patients who have kidney transplant and kidney dialysis, who can be seen through telemedicine or have a phone consultation instead of going in person and visiting the doctor at the hospital?
Yeah. See, dialysis patients doing a home consultation doesn't make any sense because they have to go to the hospital 3 times a week. And whenever they go to the hospital, they can meet the doctor there only and express their problems. But the transplant patients, yes, I would like to suggest them to always have more of teleconsultation rather than going to hospital unless they have any symptoms. So that other than that, they should do the rather than that they should do their blood test near the home in one of the labs, and then follow the teleconsultation protocol and get their medications adjusted based on the reports. So teleconsultation plays a very major role for these transplanted patients, and also the kidney patients who are on medical management. I told 3 subgroups initially. So dialysis patients have to come to the hospital, whereas transplanted patients and the chronic kidney disease or acute kidney injury patients who have recovered, they can do teleconsultations rather than coming to the hospital, because risk might be more because you are traveling, going in the hospital. Sometimes you might forget to wear your mask, or you might touch some surface. So the risks are there. So better to have teleconsultation.
So, doctor, is the treatment for COVID-19 different in case of dialysis patients as compared to transplant patients?
See, so far, whatever drugs we have, which are used in the treatment of COVID-19, are being used in transplanted patients and even the patients who are undergoing dialysis. Only thing is there is lack of data in the of these drugs in the patients undergoing dialysis or who have severe kidney failure. But in transplanted patients, all these drugs can be used. Patients who are on dialysis also we are using, because though there is lack of data in these subgroup of patients, we are trying to save life by giving this drug. So life becomes more important than the kidney itself. And however, for the kidney, we are anyway doing dialysis, so that doesn't make any difference. It becomes only a little tricky in certain group of patients where they have severe kidney failure, but they're not on dialysis. So whether to use the drug, because if you use the drug, it might be nephrotoxic or toxic to the kidney. That question arises. But whatever the dosage of drug which is being used in COVID-19 is lesser, and it generally doesn't affect the kidney functions as such.
So, doctor, if we talk about remdesivir, this drug, so what is the dosage which is prescribed for CKD and dialysis patients?
Yeah, see, CKD patients, as I told, there is something called eGFR, which is used to calculate the creatinine clearance. And the eGFR varies from 90 and it comes down. So those patients who have eGFR of less than 30, in them using remdesivir has not been studied all across the world. But above eGFR of more than 30, remdesivir can be safely used in the kidney patients. Less than 30, if GFR is less than 30, there the data is not available. But again, it comes to a point where life becomes more important than the kidney. So that's why the drug is used there. In dialysis patients, since they are undergoing dialysis, the drug gets cleared by the dialysis, and in them it can be used. Remdesivir can be used in these patients. Transplant patients also remdesivir can be used.
So another question we have from our viewer, doctor, that is COVID-19, does COVID-19 cause kidney failure in otherwise healthy adults, like patients who have not undergone any transplant or dialysis?
Yeah, that's a good question. See, now we were all speaking more about dialysis and transplant patients. So what about general health or general patient who is otherwise healthy, he develops COVID-19 infection? Now it again depends on severity of the COVID-19 infection. See, in mild to moderate COVID-19 infections, it might not affect kidney at all, or it might not affect any organs at all. But in severe COVID-19 infections, where the patients have to be admitted in ICU, in them, the risk of kidney injury is as high as 40 to 60%. Means those patients who are in ICU, if you take 100 patients who are in ICU, 40 to 60% of them will have kidney injury in the form of acute kidney injury. That is an alarming statistics. Whereas mild to moderate COVID infection who are in the wards, and they generally recover and they do not have acute kidney injury. Even if it is there, it's very mild and just subside by hydration and other supportive measures.
Okay. So, doctor, as we know that COVID-19 is creating a lot of panic and anxiety in every one of us. So, what would you suggest for the patients who are suffering from anxiety or because of the daily routine, it is causing depression in them? So, what will you suggest or advise to them?
Uh, See, the thing is, we need to understand though COVID-19 infection is highly infective, but the risk of getting serious or getting, nowadays we have seen so many of them are recovering, isn't it? Even though they are 70 plus or 80 plus with a lot of comment, they are recovering. So risk of death is very, very less. It's somewhere varies between 2 to 3% or maximum of 4% at in some countries. So we need to understand that there are very, very high chances of recovery, and this should be taken as a positive thing. And also we should not neglect other health aspects what we have, like diabetes or hypertension or a heart problem or a kidney problem. This might be much more dangerous than the COVID-19 infection itself. So that's why we need to get regular checkups done for all these issues, and do not think more about COVID-19. Try to be calm, practice meditation, and do yoga and eat healthy food. All this will help us in a longer run. But as I told, non-COVID problems are much, much more, and they deserve much, much more attention than the COVID-19 infection itself.
So, another question we have from our viewer, doctor, that what are the important steps a patient suffering from diabetes and hypertension can take to stop the progression of kidney disease?
Okay, so that's a general question what most of the patients would have. If they have diabetes or hypertension, they are at increased risk of developing kidney issue, whether it can be acute kidney problem or a chronic kidney problem. So they should keep their diabetes under check. They should keep their blood pressure under check. They should follow diet which has been prescribed to them, and they should follow regular healthy lifestyle in the form of doing exercises every day, 30 to 40 minutes, 5 times a week at least. And then they should practice healthy lifestyle and go to the or at least have a teleconsultation with the doctor in these COVID-19 times, and keep their sugar and blood pressure checkup under control. So that can prevent in progression of this kidney disease. And also other important thing is sometimes you tend to take over the counter some medications or painkillers or some drugs which you do not know. Those that has to be avoided, because that can again increase the risk of progression of kidney disease.
So, moving on to the last question for the session, doctor, what is the role of telehealth for patients having such health issues? For the patients for kidney dialysis and kidney transplant?
Yeah, telehealth has gained all the importance now, because sometimes there might be minor issues for the patient, minor symptoms for the patient. They might not be able to come to the hospital, and it doesn't also make sense for them to come all the way to the hospital and have risk of developing in COVID infection. So that's why mild symptoms has to be teleconsulted to the family doctor, whom has been seeing them for a longer time. So that's why I think teleconsultation and telehealth plays a major role in such scenarios. Of course, having said that, if the symptoms worsen, they should always come to the hospital and not wait. Recently, we had one of the patient who was regularly undergoing dialysis, and he missed dialysis for one session, and then he had to come and get admitted in the ICU, and he had a lot of issues. So, in severe cases, yes, definitely they should not neglect, but mild symptomatic patients can still do teleconsultation, and it will be helpful for them.
Thank you so much, Dr. Deepak, for your time this evening. We hope this session has covered all concerns related to this pandemic. As the situation is worsening day by day, the myths and fake news related to COVID-19 must be avoided by only relying on authentic sources like ICMR, Union Health Ministry, and WHO. Librate is also here to convey true and authentic information during this COVID era. This marks the end of this current session, and we will be back with more information in the next. Till then, stay tuned.
Thank you.